Hello, my name is Joy Ashby Cornthwaite, and I will be your host for this episode of the live stream show, MyDiabetesHQ Live. This weekly broadcast is developed by and produced by Cities Changing Diabetes volunteers from here in Houston and together with our sister city, Philadelphia, which recently joined the global network of 25 cities working to improve diabetes prevention, care, and management. You can learn more about Cities Changing Diabetes by going to citieschangingdiabetes.org. The purpose of this effort is to help people with diabetes and their caregivers successfully transition through these very challenging times of COVID-19. Each Saturday, we gather diabetes care experts to discuss and share their incredible knowledge about diabetes. They have years of service in self-care, medical care, public health, community health, and advocacy, and we will bring their knowledge straight to your waiting eyes and ears. We hope that these conversations will give you all the tools to develop and build skills to manage your diabetes and to live your best lives. Not only surviving, but truly thriving and doing the things that you want to be doing. Today's episode is coming up right now. You definitely don't want to miss this. Remember that the content shared here during the MyDiabetesHQ Live broadcast is not intended to be a substitute for professional medical advice, diagnosis, or treatment. As always, seek the advice of your physician or other qualified health provider with any questions you may have regarding any medical condition. So good morning, everyone. Happy 4th of July, and hello to all of our diabetes warriors, our champions, advocates, and cheerleaders. This is our 4th episode of MyDiabetesHQ Live. I'm really happy to have you here with us. I think you're going to have quite a treat today. To our viewers on MyDiabetesHQ Facebook and MyDiabetesHQ YouTube channels, thank you and welcome to our show. To celebrate this holiday and really put you in the spirit, today's format will be more of a potluck style meal. We'll set the table with comments from our new guests, and then we'll all sit down to a conversation like we'd expect during any family or friend gathering. We encourage you to help grow the conversation with responses, questions, and tips that we can share live with other viewers. Consider it a BYO comments and BYO questions and advice session. Sign in and subscribe to any of our platforms so that you can be part of the conversation today and every Saturday. So today I have with me a panel of experts who will share their experiences and also ideas for navigating 4th of July with diabetes and how that intersects with self-care, food choices, family dynamics, and what changes we're seeing because of COVID-19. So our first guest we have is Dr. Sonja Davis. Hi, Dr. Davis.
Good morning.
Good morning. Next, we have Cheryl Woolf, registered dietitian and certified diabetes care and education specialist. Good morning, Cheryl. She works with high-risk patients living with diabetes and their support teams to create and make management plans that are mindful of their needs and allow the family to survive. We also have Serena Valentine, CEO of Core Initiatives, a Houston nonprofit and wellness organization. She brings her special experiences as a person living with diabetes to the initiative of Cities Changing Diabetes called Diabetes Peer Support Group, where she helps others living with diabetes. And then we also have Marianne. Hi, Marianne Strobel. She is a registered nurse and certified diabetes care and education specialist. It's always a mouthful these days. She has 20 years of experience. In addition to her inpatient work, she has a particular passion for caring for individuals during emergencies and disaster. And she works with the Diabetes Disaster Response Coalition.
And in regards to that this morning, Joy, I just want to mention that we are each in our own homes, so that's why we don't have any masks on today, but because otherwise we're following the governor's order.
Perfect. All right. So, Dr. Davis, can you tell us a little bit about yourself and what you do before we start the conversation? We'll have you set our table.
Great, thank you. So I am with Texas A&M AgriLife Extension Service, and we are the educational outreach component of the land grant system of Texas A&M. We are known as the best kept secret, and that's unfortunate because we are in 250 counties in the state of Texas, and we have a presence in 254 counties. In extension, our goal is to help Texans better themselves by offering educational programs and resources for them. In extension, we have 4 educational units. The first one would be agricultural and natural resources, where we help large-scale farmers down to individuals who want to have gardens in their backyard or grow vegetables on their patio. We also have the Community and Economic Development Unit, where we help small businesses apply for grants and individuals interested in becoming HUB certified. A lot of people are familiar with 4-H and Youth Development. That's one of our most popular programs, where we help youth between the ages of 8 to 18 responsible citizens by engaging in developmental projects. And the unit that I work in is Family and Community Health. And as a family and community health agent, I go throughout Harris County conducting programs related to health and wellness. We also provide clock hours or educational training for child care providers, parenting. But I'm really passionate about the working in chronic disease. I conduct programs, educational sessions on hypertension and diabetes. So if you're interested, please contact our office, and you can just learn about all of our educational programs that we offer. I would like to share that I'm passionate about diabetes because our programs are 4 to 6 week series. And whenever I'm conducting the first class, you just see like individuals come in confused and not understanding how to eat, what to eat, and how to control their blood sugar. And over those 4 to 6 weeks, you develop a relationship with them. And it's like you see the light bulb turn on and they feel like, I can do this. I now understand how I need to eat, what I need to eat, and the importance of, talking with my doctor and making my doctor visits. So I get excited about it because I love seeing individuals know, what they need to do to control their blood sugar and keep their diabetes in check. Like I said, we are in 250 counties in the state of Texas, but we service all 254. And as part of our Cities Changing Diabetes, I would like to recognize our sister city, Philadelphia, and their extension service can be found at extension.p as in Paul, S as in Sam, u.edu. And once again, that is extension.psu.edu. And I would encourage everyone to find out more about your extension service and all of the educational programs and resources that we have.
That's amazing. Thank you so much for starting us off, Dr. Davis, that way. And I have seen you in action, and so I share and I applaud your excitement, because I think a lot of the times people may come in and they're feeling down about their diagnosis, and it's important that we act as educators but also cheerleaders, right, to give hope. And I think that's what we all do here. And I just, I think this is a perfect segue into the work that Cheryl does to help families and patients and their support group, including families and friends, sort of grow their knowledge and help one another. Cheryl, can you talk to us a little bit about family dynamics and how that intersects with the excitement and the care that we provide as people helping others with diabetes?
Absolutely. And thank you for having me today, Joy. I think family dynamics definitely plays a role in diabetes support and in management. And I think it definitely can play a positive impact on someone's life. And it's interesting because this weekend, navigating the holidays around coronavirus, going on right now, and precautions getting a little more stricter in Texas, you may not be around the same dynamic you typically are around the holidays, that big family picnic or, being with a lot of friends or coworkers or roommates. And so, navigating this weekend will really depend on what kind of dynamic you'll be around, whether, that's with your family unit or your roommate or your significant other, or even by yourself, if you're with yourself or through Skype or Zoom, there's going to be so many dynamics happening today. And I think because of this intimate setting, it's a really good time to communicate, what kind of support you're looking for to manage your diabetes and improve it and make it better and make it easier, to reduce diabetes distress and the burden that comes, along with it. And I think every family is and its dynamics are unique and also many commonalities too, around, what we experience. And so the table's a really great place to communicate and bring up some of the things that you might be struggling with or have been struggling with in the past. And communication is really going to be key to a lot of that.
Awesome. So I'm glad that we're back to this view of us all, because I think now that Dr. Davis and Cheryl have set the table, we're all coming around it, and we want to start with some really great conversations to help our viewers. And don't forget, viewers, to go ahead and put your comments in so that we can include them around the table, just like you would butt into any conversation while you're sitting around the table during the holidays. So just pop in and out as you need to ask questions, and we'll try to answer them as best as we can. So we're not going to start off with any family brawls or anything like that. I think we'll just start off with conversation. So where do you ladies want to start off? Do we want to talk about food? Do we want to talk about emergencies? Do we want to talk about if mom really thinks that all of us are wardens, or if we just want to, be normal for a day and do whatever we want? Where do we want to start off?
I think we should start off at actually telling your folks that you are dealing with diabetes, okay? Mm-hmm. I'm very passionate about this because I live it. Yeah. I've been living it for a very long time. It is difficult to talk to your loved ones. There's a stigma that comes with chronic illness. It's like, maybe I'm weaker, or my family may have looked at me as the strong person or the head of the family, and now I'm dealing with this illness. I'm sick. So now I may be looked at as the weaker person. So some people may not be willing to even share the information with their family. Not saying they don't love them or that or they feel like their family doesn't love them, but it's hard to get over that hump. So it does become difficult to talk about things like this with your family, especially when it comes to food. Because if anybody's family is like my family loves with food. So it may be taken maybe offensive to refuse food. For instance, say this is July the 4th. For instance, holidays. You have to say, no, I can't eat that. And you might hear what? You can't, what? Excuse me, I made this food. I slaved over this food and you're not going to eat it. But that's how you open the conversation to say, well, eating too much of this will make me sick. So if you don't want me to be sick, I cannot eat it. So yeah, that's a big thing. That's a big thing.
I think that Joy brought up something interesting when she was, giving a little introduction there before. And one of the things she talked about was planning. And I'm not a dietitian, I'm a nurse, but I do try to understand things from, the dietitian perspective as part of my certification. But one of the things that I try to tell people who are newly diagnosed, especially with diabetes, is that you become a role model. And actually, what people like to have with their traditional foods is we look forward to that taste and that texture. And if you can do some pre-planning and some conversation, once you've opened the door, just as you've noted, Serena, that maybe getting together and looking at the family recipes and seeing how to make them a little bit healthier. And then everyone can still enjoy that same traditional taste and texture, and everybody can feel better, because we all know that we all need to eat healthy, whether we have diabetes or not.
So go ahead, Dr. Davis.
So Marianne mentioned planning, and I think as a host and as a planning committee, we all plan out the menu. We know we're going to have this dish, but we also need to plan physical activity, and that physical activity that at all ages can participate in. We always try to have games and movement for the kids, but we need to plan activities for everyone. Dancing, line dancing, any type of movement, so that's part of the event as well. So put as much planning into the physical activity as we do into the menu.
Mm-hmm.
So when we say planning.
Okay, I'm sorry, you guys. I'm having a little internet trouble today.
Oh, that's okay. I can see you. You're good.
Okay. So can you repeat the question?
So Dr. Davis was talking about planning for meals, to grow on Marianne's comment, plan for your meals, but also plan activities around the meals. But what if, I'm just playing devil's advocate. What if someone says, let's do activity, and it's going to be good for our, for our glucose control. Do we want to go at it that way, Cheryl? Or do we want to just kind of move into it,
I think it can go both ways. It really depends on the dynamic, with who you're with, and so if it's like, you have kiddos with you, maybe doing it as this is going to be something fun and exciting, not necessarily, blood glucose control. But I think it is good to bring that up, if you do have family members that are with you that maybe want to learn more about how exercise can impact blood sugars. It has an amazing effect. And so, bringing that up with them actually can maybe have that light bulb moment for them to realize, maybe I should be incorporating more exercise when I'm with, my loved one who has diabetes.
Yeah. So having all of these planning components be just something for everyone. That way we're not singling out any,
right.
You're not forcing anyone to do anything. I know that Serena, you've talked about that, having that sort of burden that things are adjusted just for you. So I feel like, Dr. Davis, Cheryl, and Marianne are saying things that can be incorporated completely for everyone. What would you, how would you receive that as a way of support? What do you think people, do your peer supporters say about these types of things?
Yeah, most definitely. And that's a lot of things that people do not take into account when it comes to anything is planning. Planning is very important, especially when you're dealing with diabetes, because things can happen. Just like as often as your blood sugars go up and down, that's how quick a plan can change. So kind of sort of planning for anything to happen. Also, when it comes with dealing with your loved ones, they will feel more comfortable, actually, because I hear this a lot, when you do include them in the planning and you say, well, auntie such and such, she can't eat this. So guess what? We're going to make this for her, or we're going to keep this out of that meal for her, or we're going to do something. We're going to go outside and, I don't know, jump rope, run, play something, dance, anything. All of that is physical activity, fun stuff. It doesn't have to be, boring and, oh, I got to exercise. It doesn't have to be like that. It can be dancing and playing around, just having fun with your family. That can really make them feel like that they are a part. They don't have to separate themselves from family activities.
Yeah. Banking off of that, Serena, I just want to say, because I have the love of Houston here, where I've lived for quite a long time, but I also grew up in Pennsylvania, about an hour from Philadelphia. So hello again to Philadelphia. And one of the things that we always enjoyed when I lived up there for our July 4th picnics and our family gatherings was something we called beanbags. I think here you might call it cornhole, but it's the same thing. And we found that anybody of any age can certainly do it. I mean, we've even had people sitting in chairs or wheelchairs who were still able to do beanbags. Some of the guys always got around and did something called horseshoes or quates, if you want to call it that. So that was always something that was multi-generational that could be done. We had plastic models for the kids, so they really wouldn't hurt their feet if they dropped the horseshoe on their foot. And then there was always something like that going on. Croquet, if anybody remembers that game, it's the little hammer with the ball. Yeah. So those are things that are multi-generational that can be done for people with different skill levels. So those things can still be enjoyed, and they can become part of family traditions.
Yeah, absolutely. And the amazing thing is that no matter what activity you plan, it's always going to have a lowering effect on the blood sugars, and so it's good to realize that you don't have to go for a jog or a walk, to lower the blood sugars and help keep them in a healthy range. You can do anything.
And I think that this holiday season, we'll probably see that, especially the core individuals who are getting together, whoever you're quarantining with. There isn't football to watch on TV or those types of things that usually we gather around the television to do. So we can go old school and turn on music and just start dancing. Mm-hmm. I mean, it's a great time. Yeah. So what about does anyone have any hard questions? How do you, we're talking about the inclusion type, family dynamics, right? Where everyone is doing everything for everyone together. But what about, sometimes people will assume that dietitians are all food police. What happens if you find a food police person in your midst, sitting around the table with you? Serena, we talked about this. You and I talked about this.
You tell them to chill out, okay? You tell them to chill, it's going to be okay. Hey, do you want to check my sugar yourself, 2 hours after I eat? Matter of fact, you could be the timer, put them to work. If they feel like they got to be the police, then be the police. That's cool.
I really give them the entire role. You're going to go all in.
Yeah.
In my family, I would say I am the food police. So I'm learning to, just not stay on people, but just allow them to eat. I will give them the eye, or that nod, but it's something that I have to work on because, I'm doing it out of love, but I know that type of love can be overbearing. So I'm learning to reel it in and just let them go. But they know I'm watching, so they're more conscious.
One thing I want to mention too, coming from a nursing background, is that, we know that the majority of people do have type 2 diabetes, and, watching your food is important for anyone with diabetes. But we have other people who manage, because they have type 1 diabetes, and they manage their glucose control because they have to take insulin. And we even have a lot of people out there who are now using insulin pumps. And when it comes to holiday celebrations, they want to enjoy. And if they've been taught how to match their insulin to their foods and to their carbohydrate count, they can successfully eat some of the foods they normally probably wouldn't choose to eat, not hopefully in unmanageable quantities, but nonetheless, they may want to enjoy some of those holiday foods, and they can, because they can know how to match their insulin requirements. And so I think it's important for people when, they're watching others out of love, that they also take into consideration that, people have been well educated and they've got it, just like Serena said, they've got it, and we need to respect that too.
Yeah.
Absolutely.
I wanted to point out not to forget about a growing population of people dealing with diabetes, especially type 2, are children. And so I wasn't a child when I found out I was, but I was young. I was 20. So to make that even more fun for them and not be overbearing for them, because it something like that will stress a child out. They're thinking about being a kid. I want to eat all the sweets I want to eat. I like soda. I like this. I like that. And, it becomes something that needs to be addressed, especially with children, because children, they grow up to be adult type 2 diabetics, people dealing with diabetes. I'm sorry. So I think making everything fun is very important, especially for the younger population.
Yeah,
So.
I think we forget that our love, because when I'm speaking to my family members who are living with diabetes and I'm really wanting to help them, I think it's something really important to remember that in order to love them, in order to support them, we also need to not create an anxiety and a fear for them. And so if we're, if they're wanting to have something to eat that may be higher in glucose, maybe just, from a distance, let them be them. Every day is a day living with diabetes. We have holidays and we take breaks all the time, not living with diabetes. And so our loved ones want to live as well, and they want to thrive. And so I think it's important that we understand our role as people who support and not bring anxiety or bring fear. I think it's a two-way street, right?
Right. I think you're right, Joy. I am a mom of now an adult with diabetes, type 1, and she was diagnosed when she was 10 years old. So we've lived through, all these different layers of the timeline so far. And of course, she wanted to go out and do Halloween, and get candy just like all the other kids. But she did. And she was wearing an insulin pump. So that's why I brought that up earlier. She had been taught how to manage it. And together, we managed it. And she got candy. None of my kids would eat all of the candy at one time. So she didn't either. But, she was a kid and she had her kid times. And so just to bring it into, you were talking about, Serena, how they grow up, their children, and then they grow up as people living with diabetes. So today she's actually a certified diabetes care and education specialist as well, and a dietitian. And so she brings all of that into her practice every day with all of her high-risk patients that she deals with. But she can truly understand exactly what you said, Joy, in that we all like to take a break now and then. So everybody does, whether you're living with diabetes or not. The key is what we mentioned at the beginning, is that planning. And actually, everybody should plan, whether you have diabetes or not. We all need to plan for what we're going to do in order to stay safe with everything that we do in life.
Yeah. So don't forget, viewers, to add your comments in. Since we're talking about food police and an individual. Go ahead and drop your comments in there. You know, if my mom is watching, go ahead. Sometimes I do that. But if you want to call out your food police family members, go ahead and drop it in the box. We'll shout out to them.
Mm-hmm.
Don't hurt anyone. So in that same vein, if we're being supportive and we're not trying to create anxieties that are totally unwarranted, what about the safety concerns? You know, so if you're standing sort of in the wings and you're aware that someone you know and you love is living with diabetes, how can you provide support in terms of emergency care should they have a situation, you know, at the gathering that you need to help out with? Do you have any tips as educators, as clinicians out there?
Yeah, so it kind of goes back to being, you know, prepared. And, you know, if you haven't experienced this before, or you have experienced this, you know, talking to the person, you know, in your family living with diabetes, you know, what can you do in those situations? So you're ready, you know, if they decide, you know, they want to have a little more cake this year, or, you know, their blood sugars do spike up a little bit more, you know, or drop low, you know, go the other direction. You know, what kind of response can you provide for them, whether that's, you know, having glucose tablets on hand or glucagon, knowing how to use it, knowing how much to give someone, or if their blood sugars go the opposite direction, you know, can I offer them water? Can I take them on a walk? Can I help them with their insulin injection? And so understanding all of these components, you know, of safety really is going to be communicating with your family member, and then also being prepared and having all those items around ready to use.
Yeah, there's a viewer on who's sending us a tip right now. Thank you, Glenn. Glenn talks about the interactive technology that's designed to help with self-management. So I know that I have a loved one who wears a CGM, and I have been graciously offered and trusted to be able to see their glucose values. And so, you know, I think that can help the individual. It can help your family members as well. That's always an option. But one of the things that I learned about having that trust and having earned that trust is that I don't jump on my family member every time I see one of those numbers. So technology is great, right? You could get an alert that says your family member is going low, your family member is going high. But I've learned to take a step back if those things are happening. It is just an alert to me. It doesn't mean, Joy, go fix it, right? It means, Joy, you know, I may need help, be prepared. And so I think for that family member, initially when I first saw it, you know, I would send a message at maybe 2 a.m. Are you okay? And then I'd get a message back like, seriously, what are you doing awake now? Sleeping? Why are you calling me right now? Have you all ever had that kind of experience with someone where, you know, and Serena, what would you say to me if I called you at 2 a.m.?
I probably would not pick up the phone. I'd probably be like, I'll text her in the morning. It'd be like, oh, sorry, I missed your call. I'm good.
The only problem is, Serena, you know, those of us who love you and would care about you may be inclined to want to call for a courtesy check from the local police. I mean, that's the only thing. If they ever react, right? I don't know if anybody's ever done that. I haven't, but I've been thinking about it at times, you know, and we live on that edge until you do call us back. But, you know, Joy is right. We have to learn to trust and know that you've been well educated and that you know what you're doing, and you know, just be patient and that you will get back to us. Yeah.
Right. And you know what? There are a lot of people who cannot get the CGMs. Insurance may not pay for it, or they don't have the money for it. So those stories, those get a little tricky, because it's like now you have to rely on, paying attention to your body and how you feel. And sometimes if you're asleep, you don't feel it. So it's important, especially if those people have other people that they're living with, that they actually talk to them. It's very important for them to have communication open with them about it, because if you don't have a CGM and nobody's watching you or paying attention to you, an ER visit can happen really quick. So, yeah.
And one of the things that we as, people that love people with diabetes or care for them is we can always be prepared too. Like I always carry glucose tablets in my purse. I never go anywhere without them. And so if I've been places with friends or family and they ran out of their own supply, and I always have it with me. So, that's just another thing that we can do for pre-planning, is not only learn about it if we have diabetes, but also, teach our family members, like you said before, so that they can be prepared to help as well if needed.
Definitely. It's good to look back on past experiences too. So having reoccurrent themes every year of ending up, in the emergency room or bad at the end of the night after a hyperglycemic, episode. How can you make that better? And so look back on your past experience to be able to make a change and help your family understand, your needs to improve upon it.
Yeah, I think one of the things that I stress in sessions with patients and family members, support members when they come in, I do go over like what is a treatment plan to control a high for a person, and then to help manage a low, to manage a high, manage a low, and then have the person who's living with diabetes explain to you what their symptoms are, because everybody's symptoms are not the same. And so that's part of the planning and the preparation. I did some volunteer work, and I was at a location. I was giving a talk, and there was a play area for the guest speakers and the guests at the session. And my kids were spending time with children living with type 1 diabetes, and they were playing on the playground, and they had their nurse. And one of the moms came up, and she was standing next to me, and I saw a little girl, and I kind of walked one of the moms through it. She was a leader, she was sitting there, and she was guiding all the other kids to build these blocks up and then destroy them and then rebuild them. And everybody was in on the game, and there was a pause. Everybody checked their blood glucose values. And then everybody went back to playing. And then slowly her personality started to change. And I didn't know this little girl, but I'm an educator. But I could see she's super bubbly, but she started to get, where she was a little irritated. She was getting grouchy, but it was very evident. Instead of helping build up, she was throwing the blocks at children. And so then her little alarm went off, and I kind of walked one of the women that was there who had never dealt with children living with type 1 before. And I told her it's a personality change for her when her blood sugar starts to lower. And so to use situations like that, I don't think that mother who didn't have a child living with diabetes, I don't think she'll forget that moment, because it was in the moment. And so now she can take that information with her, perhaps as a teacher or, as someone in a grocery store to help out a mom who may be experiencing this. So I think that all of that planning and education and prep is super important.
Yeah. I think one of the things that I try to do too is when I get a patient, especially that's newly diagnosed in the hospital, and I'm talking with the patient and with the family, is one thing that I try to bring up, because sometimes the patients will say it's going to be very hard to talk to my rest of my family about having diabetes. And I try to say to them, and while I don't know the exact conversation starter that they should have, because each family is different, but I tell them that they kind of almost have a responsibility to bring up the subject, especially with type 2 diabetes. being genetically linked and in families, and that, they're being a role model, and they kind of have that responsibility to bring up the subject so that they can help other members of the family remain and be as healthy as they can be as well. I don't know how you feel about that, Serena, because I know you live with diabetes, or if Dr. Sonja has some other input on that, but I'd like to hear what you have to say on it.
When it comes to stuff like that, like I said before, communication is very important. And a lot of times it will be very hard to deal or to talk to people that you love and tell them that you're sick. But when it comes to especially dealing with type 2, like you said, it's kind of hard to put all of that in words for me, because it took me a long time to even feel comfortable checking my blood sugar around people, because it's something that you don't want to admit that you have a weakness, but it's a weakness that if you don't admit it and tell somebody about it, you can put you in a very dangerous situation. So yeah, I agree, Marianne.
Yeah.
So how do we as clinicians, Cheryl, I know that I'm always really encouraged by the way that you interact with your patients. It's just really beautiful to watch and to hear feedback from your patients saying how much you've helped them. What are some of your strategies for giving people space and then encouraging them to ask for help?
Definitely. I think it's good to, focus on real life situations, right? Be specific. And I think whenever you're trying to communicate anything, it's good to not be broad, you haven't been helping me with this, or you don't understand what I'm going through. Specific about situations where you need help, or where you haven't, seen that help yet, whether that's food, does your family understand, what your needs are, dietary needs, or do they understand how to help you in safety situations? And so bringing up those specific times and moments of which you're actually struggling with, that's important and key. And then bringing up those experiences helps, the other person, your loved one, relate and understand, oh, that did happen last year. What can we make better? How can we change this? Yeah.
What do you think, Serena?
Oh yeah, of course. I'm sorry, y'all. I'm listening and I'm taking in because I'm not a clinician. I need to hear the other side. Because us as the people who are dealing with diabetes can tend to judge a clinician by how we feel like they're treating us and things like that. But to hear that there are some that actually do care and actually want to help people who are dealing with diabetes is wonderful. I'm sorry, I'm just listening.
It's important to communicate those same things with your clinician just as much as your family and friends and coworkers, because your clinicians, your healthcare team, that's your system as well, and not everybody has a family and a close group that can help them, and so the healthcare team is someone. People to be in communication with your needs. It's so important. We're here to help.
Yeah.
I'd be interested to know
that the peer support. I just wanted to throw that in, y'all. This is a mini commercial in a few seconds. Go to Facebook and hit the search button. If you don't have, unfortunately, you don't have people who support you, we will. So if you hit the search bar and type in Houston Diabetes Peer Support Program, ask any questions you would like okay? Ask any questions you would like. It is a private group, so you must answer the questions first. But once you're in, you're in. We share all types of information. And we have people on there that just say, hey, I'm just not feeling good today. So if you're one of those people who are just not feeling good that day, there's a lot of people who will encourage you to have a good day. Okay.
Awesome.
So in the spirit of communication, this is, this goes, I think a little bit deeper in terms of help, of having someone that you support help you, like manually help you with your care in an emergency situation. We have a Facebook user who's asking, since this quarantine, is it okay to teach your loved ones how to give your insulin shot for emergency purposes? What do you all think about that?
Absolutely.
Y'all would not believe me, but I made everybody give me, when I was taking insulin, I made everybody give me a shot because I wanted them to know how to do it. Now, it took them a while because they're like, needles. I don't want to do this. Like, they're thinking they're going to hurt me. I'm like, no, go ahead. You got to do it. I'm not leaving here until you do it, because I need to be sure if I'm around you and something happens to me and you got to give me a shot, you have to do it. I said, so imagine I'm dying. I lay on the floor. I'm dying. Give me my shot, check my blood sugar. So eventually I got to do it. But it was like pulling, yelling, screaming. So I did that.
Wow. Serena.
Dr. Sonja, do you teach that also? Is that part of something that is encouraged with people that attend the classes through Texas A&M Extension? I don't know if you can hear me.
We don't, that's not something that we teach. I will speak with our specialists. What we teach is how to manage it and manage high blood glucose and, how to bring your blood sugar back up in case of lows. But I do think that's definitely something that needs to be discussed.
Yeah. And I think, I know I do. Sometimes we have people who have just been diagnosed and they're very, very afraid. And they're afraid to check their blood glucose value, or they're afraid to give an injection. So we encourage them, if for their first appointment they haven't brought someone in with them, we encourage them to bring someone the next time. And during this time where we're social distancing, we encourage them to join via some sort of FaceTime or Skype or like some video way to come into the appointment with them, so that we can show everyone how to do the proper steps of an injection, and share with people, your dosage, carry a record of how much you take of your medication, so that someone's able to help you. So, but I think the training is really an important part for the person and their support. Just in case, like Serena said, if I'm in a tight spot, I'm going to need your help. I'll call you out to help me. Yeah.
Right.
And it's almost important, to even involve, your children too in that process.
Right.
Kids who, it's amazing what kids can do. I have some, patients that have, their 7 and 8 year olds or their 10-year-olds, helping them with their injections. And that's, when I first heard that, I was like, just, it's, and it's amazing, even if you only have, your child, with you and your family, it might be a good idea to still, bring that up with them, because, kids can learn pretty quickly, especially with technology. Right. They're pretty savvy.
Right. Yeah, they're amazing. Yeah. I know. I taught my 8-year-old daughter how to actually give a glucagon injection to her 10-year-old sister. I don't know if she would have been able to do it, but she listened, and we did go through the training. And I was amazed that she sat there to listen, and she was just so worried about her sister that she listened. Luckily, she's never had to give her one, but she did learn at age 8. So you're right. We can
and they hear so much more, and they know so much more. I mean, Lord knows for really anything. Kids are, they're resilient, and they are there to love and help. And I've had the same experience with young kids helping their moms, and being able to call emergency services and give or I have them even in my office. Like if someone is experiencing a low, I'll let their child bring them the glucose tablets and walk the entire situation with them all sitting there, and they're really great at helping. Yeah. So that is so awesome, guys. I'm so blown away by this conversation. I really am.
Dr. Sonja, do you usually have people when they come to the classes? Do they sometimes bring a loved one along with them to the classes? Is that something they might do?
Yes, we definitely encourage them to bring loved ones. And sometimes we have individuals who just come because the individual living with diabetes doesn't want to come. They come to get the information for them. Yes, like in the case of a spouse or a care provider. So they come, but we do encourage individuals to bring support with them to the class.
Wow, great. That's good. Very good.
That is so great. So as we're getting close to the time where we actually have to say goodbye, and if you guys are anything like me, every time I go somewhere, I hang out with family, I hang out with friends, even on video where my family, my siblings, I have lots of them, will be on probably this afternoon talking, and it's like, I want to say goodbye, but I don't want to say goodbye. Like it's time to say goodbye, but you keep coming back for more. So before I wrap it up completely, I want to just have you all tell me, how you feel and how optimistic you feel about families being able to successfully create environments where the needs and concerns of people with diabetes can be met, so that we can all enjoy the holidays to their fullest. I just want you guys to kind of, what are your thoughts about that? How do you feel that we can make that most successful? Before you leave me.
Well, I think one of the ways is, really getting people to understand the importance of taking the classes and bringing, as Dr. Sonja said, bringing, family members to the classes, or even having the family member go to the class if the person with diabetes can't go at that time. And so I think that, one of the most important things is, as I think we all mentioned throughout our conversation today, was the importance of the diabetes self-management education classes. And so, I don't know, Dr. Sonja, do you want to tell us any more about how, you feel the importance is of people attending?
I think it's really important, especially it's about taking control of your life, and no one's going to care for you better than you. So the more information that a person living with diabetes can obtain, the better off that they will be. And just having that family support, and I know we're getting ready to work on a project with Mary Ann that we're planning to release in September. We're really excited about the partnership. But I think just trying to get as much information as possible so that you can know how to better manage your own diabetes.
Definitely. I think, this conversation, has we really talked about, being able to learn the different aspects of diabetes, whether that's, eating healthy or, safety. We talked about that quite a bit, emergency situations and, DSME classes. These are an important way to learn from, certified diabetes care and education specialist or dietitian or healthcare, worker, someone in the community. All of these amazing ladies up here today, what they're doing and going to some kind of class, and then bringing your family with you is a form of self-care. You know, they're there to help you, and you know, by bringing them along is only going to help you even more. You know, having a you know, it takes a village, you know, like the saying goes.
I think honestly that all of this begins with the person who's dealing with that wonderful health team who is there for you, especially while you're there with them. But when you leave the doctor's office, and if you don't tell anyone or you don't let anyone know what's going on with you, it kind of makes you draw. That's the beginning of you retreating back to yourself and isolating yourself. If you open yourself up to tell at least one person in your family, someone who lives with you, start there. Start with the people who live with you. You tell someone who lives with you, so that even I've seen that people love you enough, they will go find out on their own. They'll go research some things on their own. I've had some family members, when they found out I was diabetic or dealing with diabetes, they would send me articles and like, hey, look, I found this on the internet. Maybe this can help you. You know, you got to give them a chance to open up to you, so that you all can just do a big family hug and be close, because that's important. That's very important.
Yes.
So it starts with the person dealing with diabetes.
Yeah, and then includes the community giving a big group hug.
Yes.
Joy,
And support. Yeah, agreed. Yeah. Sonja.
Joy, I wanted to mention, we mentioned extension in Texas and we mentioned extension in Pennsylvania, but I do want to let everyone know that every state has an extension program, and I would like to encourage them to go and seek the educational resources and programs that their state extension office may offer. And extension is also in Hawaii, Puerto Rico, and Alaska. So just seek out and learn about your extension program.
Yeah. And I wish we could continue, guys. I really do. I think we should probably, you know, just keep this type of format and this kind of conversation in mind for future broadcasts as well. And y'all, if you have any of our viewers, if you have any suggestions or comments or requests, just go ahead and put them in the comments below, because I think that this is all very important components, as Cheryl says, of self-care, where you extend to your support the same education and express your needs and your wants, so that they can actually help you. I think that we could do a whole nother, you know, hour, probably 5 hours on this very, very topic.
Yeah, we like to talk about diabetes. And Dr. Sonja, one thing before we leave, I just would like to ask you a little bit more, if you could share about the diabetes self-management education classes that are going to be coming up through Texas A&M Extension.
Yes, so we're partnering with Mary Ann. She initiated this conversation. We're partnering with Methodist Hospital, and we are going to provide 6 30-minute classes or educational sessions. And we're looking at Tuesday and Thursdays for 3 weeks, and starting about 11 o'clock to 11:30, and maybe going to 11:45, depending on questions. So we're looking to begin those sessions in September. Right now, we're in the planning phase, making sure we're not putting too much in one session, and making it interesting enough that individuals will want to come back for more classes. So there will be some additional resources to support those classes, those sessions after the 6th, but we're excited about it. We know individuals want the information. And
Yes.
Due to COVID, we're not able to go out into the communities like we would normally. So something new, the pandemic has caused us all to think differently. And we're excited about the opportunity.
Yes. And can people from outside of Texas join those, Dr. Sonja? Or
Absolutely.
are they? Oh, they
absolutely.
can since they're virtual? Great, great. Is there a way, so do they just go on to the Texas A&M AgriLife website to find out more?
Right now, I would say we will post it on our Facebook, well, on our website in
Okay.
mid-August. And we
Okay.
have a very active Facebook page, and you can find that at the @ Harris County FCH. So that
Okay,
is
great.
at Harris County F as in Frank, C as in Charlie, H as in Harry, FCH.
Great. Thank you.
Thank you, Dr. Davis. That's so
Thank
much
you.
good information and resources. And thank you guys again for getting on this morning, this holiday morning, taking a little bit of time away from your core family groups right now. This has been another really, really brilliant conversation with our panel of amazing guest speakers. I'm so honored to work with each and every one of you in our community. So thank you again so much.
Thank
And
you, Joy.
of course. And as usual, I have continued gratitude to our viewers. Your responses made this conversation so robust. Please mark your calendars so you can be with us again. We will be broadcasting as usual every Saturday, 10 a.m. Central Time and 11 a.m. Eastern Time. Our next episode will air next Saturday, July 11th. And we will be taking on diabetes, COVID, and food insecurity and talking about how to navigate resources in our communities. Thank you, everyone. And I hope that you feel that you're a part of the MyDiabetesHQ community because we really, really, truly appreciate you. See you next time.